Hello, everyone, and welcome. In just about a month, the number of COVID-19 cases in the United States has jumped to about 750,000. Many of those infected with this novel coronavirus that causes this disease will need to go to the hospital because of severe breathing problems or even respiratory failure. FDA has cited a model recently that projects that about 30% of those hospitalized will require ICU care. They will need to be placed on a ventilator just to keep them breathing, keep them alive as they recover. Studies have shown that only about 60,000 or so full-service ventilators are available in the US healthcare system. And those are also not homogeneously dispersed. So there's a real concern that in the hotspots or emerging hotspots, we may not have enough ventilators as more and more patients are admitted to the hospitals and more and more of them require care in the ICU. So when I heard the news that many automotive companies are partnering with medical device companies to quickly ramp up production of these medical devices, I was both intrigued and super excited. So in this video, I'm going to give you an overview of these partnerships that have been announced, the kind of ventilators they're going to produce, and their plans. It's a race against time, because even though social distancing is helping us flatten the curve, there are still a lot of people going to the hospital, and a lot of them are having to be put on a ventilator. So medical companies and auto companies are really working together 24/7 to make this happen. Now, this is an overview of different partnerships. The first partnership I became aware of was between General Motors and a company called Ventec out of Washington. Ventec has an FDA-cleared ventilator by the model Voxen. So GM has announced plans to set up a clean room facility in their Kokomo, Indiana plant, and production has already begun, actually. They are projecting about 10,000 per month, 200,000 by the year end. The typical unit costs about $18,000, so it's a mid-range ventilators, but fully functional and a good product. GE Healthcare and Ford have also announced a partnership, licensing a technology from a company called Aeron in Florida. Aeron has an FDA-cleared product, P Newton. It's a pneumatic system. So it's a simpler system, simpler design. They will start producing in the Michigan plant. Production should be beginning by now. 1,500 by April, 12,000 by May, and 30,000 per month after July. The typical unit costs about 7,000, so it's a slightly less expensive model. Now, Medtronic, the leading company in this space, has already announced plans to scale up production of their top-of-the-line PB980 model. That also is FDA cleared. 1,000 per week by June, and it's going to happen in their plant in Ireland. Foxconn has announced plans to produce the PB560 model. Remember, PB560 model is the one that Medtronic made available as an open source model during this crisis. And that's a remarkable and an unprecedented move by a medical company to help out in this crisis. The hope is that companies across the world will actually look up this model and this design and come up with their plans to produce this only during the emergency. There was also news about Tesla partnering with Medtronic. I don't have much details about that. I just know that they are probably going to be supplying some parts for the PB560 production at Foxconn. Now, last but not the least, and this one I'm particularly excited, Xerox partnering with Votrans Medical. Xerox has been a household name, printers, faxes, all kind of devices, but Xerox has not been doing that well lately, so it's good to hear them coming back. Votrans has a FDA cleared product called GO2 Vent. It's a slightly different kind of a ventilator, designed and used in emergency situations only for short term. But for this particular case, under current circumstances, FDA is authorizing the use of this device for COVID-19 patients. This will be used together with another device called APM Plus, which is also FDA cleared, and it's a battery powered monitoring device for airway pressure. So together, these two devices will work in more of a closed loop control system. Very impressive plans again. In the Rochester, New York plant, they plan to produce about 40,000 in April, 150,000 to 200,000 per month, very large number. And hopefully this will pan out. And collectively, all these companies I know they're working fast and hard to make this happen. So hopefully these numbers will be realized. Now, there are some concerns because particularly in the medical industry where I work, people have expressed a concern that automotive industry doesn't have much experience producing medical products. And to some extent it is true. But we also should keep in mind that automotive industry is also a regulated industry. They have strong quality management systems, great people, great automation, technology. But most importantly, they have a vast network of suppliers and their downstream suppliers with equally good technology. So this is the strength and the scale that they bring to party. And I'm not much concerned as long as they are working together very closely with medical companies on products which are already cleared. And the design has been proven to work, shown to work in the hospital environment for these difficult problems. So it remains to be seen how well it'll be executed, but there are signs that it can really, really help us solve this problem very quickly. So there was news that the first ventilator produced by the GM Ventec partnership has already been shipped. That has been tremendous, very quickly, and I'm so excited and proud to hear that news. So I'm really hoping and praying that all these plans pan out and we quickly get out of this crisis situation and not only solve this problem today, but also build our stockpile for future. So there's a lot going on. Almost on a daily basis, FDA is authorizing medical products for use during this emergency, for uses that are not already approved or cleared. So there's a little bit of risk, but there's a lot going on. And as a result, it's difficult to keep track of all these changes. So what I'm trying to do is produce these videos as a resource for you. Summarize the developments, give you my insights, and bring you the information from multiple sources all in one place. The best way to keep track of all this is to go to my YouTube channel. And you can look up my YouTube channel and go here and subscribe so that you are notified every time I produce a new video. I'll also be posting these videos on my social media profile and give you a link that you can use, especially if you're on LinkedIn. You will see a link that you can go directly to my YouTube channel and subscribe. I would love to hear your questions and comments, and especially if you have topics or questions you want me to look into and produce this information for you, please let me know. So thank you for your interest and attention, and I look forward to talking with you again.